So let's talk about the drug Humira for your autoimmune inflammatory disease. But first, let's of course explain what an autoimmune inflammatory disease is. It's basically a condition where the body's immune system, we all have it's supposed to fight off germs. That immune system starts attacking healthy parts of the body completely by mistake. And this creates an autoimmune inflammatory process. When you have that, it creates swelling and pain in different areas where you're hurting, like the skin, the gut, or the joints, depending on what your disease is. So you have something called a TNF in your body. It's a protein. It stands for tumor necrosis factor. It's basically a protein that when it gets high, it causes pain to be high. It works really hard. So what Humira does is it attacks this TNF and it stops it from working. And then your inflammation goes down. So when your inflammation goes down, you have less pain, you have less swelling, you have less damage to the areas that are hurting by this inflammation. So for example, if you have the diagnosis for Crohn's disease, it'll lessen the damage to the lining of your gut or your intestines. Because too much inflammation for too long causes more damage to the area. So the hope is that Humira over time will keep this inflammation under control and slow the disease from getting worse, causing less damage. So it can be very effective in managing your condition. Humira is given by injection. It goes right under the skin. Once the drug goes in, the drug will slowly enter your bloodstream. Then the drug will travel all around your body to reach different tissues and search for what is inflamed. So again, if you have Crohn's disease, it'll search for the inflammation within your gut, and then it'll attack. It'll help that inflammation go down. So if we're treating also, let's say, rheumatoid arthritis, it'll search for the inflammation in your joints. Humira has to go somewhere in your body to break it down, or what we call metabolize. So basically, it gradually breaks apart through your immune system and the use of other cells over time. So once Humira does its job, the leftovers will leave your body through your kidneys and through other cells. This process is slow because it's really not like taking ibuprofen every 6 hours. It works over some time. So we dose the medication just so that you have long-term effects from the Humira, and you only need to take the medication just about every 2 weeks after you start a larger dose to keep the pain controlled. So let me simplify. The drug is injected under the skin, it gets into your blood, it spreads throughout your body to find the inflammation and make it smaller. The drug breaks apart slowly and stays in your body for about 2 weeks, so you don't have to take the medication that often. Of course, like any medication, we're always worried about effects from the medication, but some are rare and some we really watch out for. When on Humira, everyone is actually at risk for infection because your immune system is working hard to get inflammation down versus finding an infection to get rid of. So you really need to be careful when you're around sick people. If you know that someone's sick, I would stay away from them while you're on Humira. We're particularly careful with older people while on Humira because they can get infections like pneumonia, fungal infection, viral infection. These kind of infections can be very detrimental to older people. They can become very ill. Older people also have a slightly higher risk of getting certain cancers. They're called lymphoma or skin cancers when on Humira. So we look at their history for any chance that they have of getting these types of cancers. We'll also look at their health history to make sure if they have any heart conditions, because Humira can make those conditions worse. With the little kids, they're really at risk for infections as well, because remember, they play with other children at daycare and at school, so they can get sick pretty easily. But some other concerns we watch, there's a concern of a growth factor that maybe a child might not grow as tall as their potential. So we monitor that with a growth chart and make sure that nothing's being affected. The risk for cancer in a child while on Humira is rare, but it's also possible. So we still watch for these things. But Either way, both age groups need to be monitored closely, and you must take your medication as directed and make sure you come to all follow-up appointments.